pandemic, while other pressed health matters were sidelined, and one such matter was the HIV/AIDS pandemic. Now, this evening, we take a look at how this setback has affected the government prior's efforts and the way forward. And I'm now joined by the Deputy Chief Clinical Mentor under the Directorate of Special Programs, Dr. Jacques Kamangu, from the Ministry of Health and Social Services. Good evening, Doctor, and welcome to the show.
Good evening, and thank you for inviting me.
All right, Doctor, let's begin by taking a look back at the strides that we have made as a country against HIV and AIDS for the last 10 years.
Great, yeah. So Namibia, together with many other countries in sub-Saharan Africa, were severely affected by the HIV pandemic. So the first case of HIV was diagnosed in Namibia in 1986. And at that moment, the government or the country did not have any antiretroviral therapy. Then the government or the Republic of Namibia adopted a antenatal care sentinel survey just to monitor the progress of HIV in the country. So in 1992, the prevalence through that survey was around 4.2% prevalence of HIV, and this could reach the peak in 2002, around 22% of HIV prevalence. So in the same year, in 2002, through the support from other implementing partners like CDC Namibia or through PEPFAR support, the antiretroviral therapy were available in the public sector. And the same year, Namibia came up with the first national ART guideline just to manage people living with HIV. So as time passed, more people were put on treatment, but not all of them were really eligible. So those ones who were diagnosed HIV positive, they have to wait until their CD4 count reach a certain level for them to be put on treatment, or if they develop any other comorbidities like tuberculosis, and they will be put on treatment. Then we worked like that until 2017 when the WHO released another guideline which recommend to put everyone on treatment irrespective of the CD4 count. And that moment in 2017, Namibia also applied what's called treat all, and more people were put on treatment to save life. So in 2019, the WHO again released another guideline which recommend the use of dolutegravir as part of the first line ART regimen for adult and pediatric population living with HIV. And the government revised the national ART guideline to align with the WHO. And more people were put now on preferred first line regimen, which is based on dolutegravir, which is an effective drug to suppress the viral load. And by October 2020, more than 80% of adults living with HIV were on dolutegravir-based regimen, which is the safest regimen and effective. Then in July 2021, the country received the dolutegravir, the pediatric formulation. And from there, the country engaged into the transitioning, make sure that all the children, they are on the safest regimen. And by June 2022, more than 98% of children were successful transitioning to dolutegravir-based regimen, which is safer as well for them.
All right, now,
so
Doctor.
Currently, we have 90%
now, Doctor,
people living with HIV on treatment.
Okay. Now, the COVID-19 pandemic hampered and delayed many other health interventions that were categorized as critical prior to the pandemic. How did this intervention around HIV and AIDS suffer during this time?
Great. So, as COVID-19 affected the world, Namibia was part of, and the supply chain of HIV commodities were affected. So, as the strategies or the measures to control the COVID-19 was to observe social distancing and also to decongest our ART facilities. So we were able to give more ARVs medication to our patients so that they can take this medication at home and stays at home without coming back at the facility within a shorter period of time to get their medication. But the supply chain was affected, which could not allow us to continue with the same trend of giving enough medication to the patient. But the good things, we did not face any interruption of services. And another measure, another restriction for COVID-19 was people have to stay at home. So some healthcare providers dealing, for example, with HIV testing in the community, or those healthcare providers dealing with voluntary medical medical procedure, they were not fully operating. So they're operating at the minimum level where they could do some intervention which were quite emergency than the routine intervention. So this was also affected by the COVID-19 pandemic in Namibia.
All right. Now, how do the new HIV infection statistics look like at this point?
Yeah, so at this point, currently, what we should know that we have around 220,000 people living with HIV, and the prevalence of this HIV among adults from 15 years and 15 years to 49 years is around 11.8%. But the incidence, which is the new infection rate, the rate is around 2.9 out of 1,000 individuals. So after 1,000 individuals, 2.9 tend to be HIV positive. This is in the general population, everyone included pediatric. But when you disaggregate to adults, 15 to 49 years old, the incidence is quite high, which is around 5.6, 5.1%. But we have also the vertical transmission, which is the transmission between the mother to child during pregnancy, breastfeeding or during labor. And this transmission rate is around 4.5% of new infection among babies born from HIV positive mothers.
All right. Now, what is the way forward in the continual fight against HIV and AIDS, especially now that our focus is no longer so strongly on COVID-19?
Yeah, so the world is striving to end this HIV by 2030 by reaching the UNA target of 95, 95, 95. And Namibia is among the countries on good track to end it, and the country is striving to reach out to those they are living with HIV while knowing that they are HIV positive. So the country is putting mechanisms in place, intervention in place to get these people know their HIV status in order for them to be put on treatment. So on that note, more effort is put on what we call HIV recency testing to identify what are the hotspots where people living with HIV, where new infections are coming, and also the targeted intervention, which we call index partner testing. Additional to that, they can't want to maintain all the patients living with HIV on treatment in order for them to achieve what we call durable viral suppression by coming up with a different service delivery model, which will reach to the patient without them struggling to get access to antiretroviral medication. Some of the differential service delivery model we are focusing on to maintain our patient on HIV treatment is some of the model are like the community dispensing model of ART. We also have another differential service delivery model of reaching men living with HIV. We also have another differential service delivery model which coming soon. We want to integrate mental health in HIV, and we have also, as well as the Namibian adherence treatment support, particularly which focus to adolescent and young adults. So we should also look at in the fight against HIV at the prevention. So we are now concentrating our PrEP, which is a post-exposure prophylaxis, was introduced in the country in 2027 for the general population. Nowadays, we are focusing on pregnant and breastfeeding women because we are picking new HIV positive mothers, pregnant and breastfeeding women, which delay us to reach what you call elimination mother-to-child transmission and talk about HIV-free generation. And the other package of prevention are still going on, like the voluntary medical medicine procedure, and also bringing nowadays the cervical cancer screening among people living with HIV, women living with HIV.
All right. Dr. Kamangu, thank you so much for joining us this evening.
Thank you.
All right. That was Dr. Jacques Kamangu joining us, talking to us about the statistics of people currently living with HIV post-COVID-19, since HIV was one of the diseases that was sidelined when a COVID-19 struck the world specifically Namibia in 2020, pardon me. Don't go anywhere. We'll be back shortly to give you what's happening in the entertainment front.